Greetings, aspiring healthcare professionals. This is NurseEdScholar here. Today, we're going to embark on the journey through the cardiovascular assessment. Understand this is just a brief overview to kind of give you a summary of the cardiovascular assessment. All righty. So when we're starting, of course, with data collection. Um, Initially, you'll start with subjective data. And so when you talk to your patient, you're going to ask them questions to gather this information that you need to develop the plan of care. So you're going to ask them, are they having any chest pain, any dyspnea, cough, fatigue, edema to the extremities, nocturia, leg pain or cramps, which is also called claudication, changes in the skin color of the extremities, um, obesity. You're going to go further and to ask questions regarding their medical history, any medications, any cardiovascular risk factors, personal history of cardiac or vascular problems, or any family connections to cardiovascular disease. Okay. Then you move there and then you go to data collection for objective data. Okay. So you're going to assess through, of course, inspection, palpation, percussion, auscultation, um, beginning with palpation, you're looking, can you feel the apical impulse, which is the apex of the heart is usually around the fourth or fifth, depending on your reference, intercostal space, midclavicular line on that left side. Um, and this, will help along with auscultation to identify the heart sounds and if there are any murmurs. So let's go into auscultation. Auscultation, you're using your stethoscope, you're determining, what's the heart rate, what's the rhythm, any kind of potential abnormalities. You're going to assess each valve, like the aortic valve, that second right intercostal space. Then the pulmonic valve, which is the left second intercostal space. Erb's point, third left intercostal space. Tricuspid valve, fourth left intercostal space. And then the mitral, fourth or fifth left midclavicular line. When you listen, you're going to pay close attention to see if there are any murmurs, which are, murmurs or blowing or swishing noises, kind of hints at some kind of turbulence within the cardiovascular system. And then also, you're going to assess S1, S2, that's that love dub, listening for extra heart sounds. Then you'll move on to the peripheral vascular system, where you'll evaluate blood flow, by palpating the pulses. You're going to be looking at skin condition. You're going to be checking for edema. You may even have to measure the calf circumference. And don't forget the carotid arteries. You're going to palpate one at a time to avoid compromising blood flow to the brain. Okay. Um, which, if they're done simultaneously, a person can become dizzy and lightheaded. We do not want that. So palpate one at a time. Um, then you'll auscultate each artery to a carotid artery to assess for a bruit, which is a blowing or a swishing or a buzzing sound. And what a bruit is that it indicates blood flow turbulence. All right. But remember, typically a bruit is not present. So if you hear one, you need to document it and then let the healthcare provider know. And that, we go on and it leads to client teaching. The things that you gather with your subjective data, these are the things that you're going to encourage during your teaching. You're encouraging lifestyle modifications, which could be changes to the diet, exercise, sleep, avoiding smoking because smoking can raise the blood pressure. You know, just kind of emphasizing these risk factors. We talked, and then you're going to discuss with your patient about regular physical examinations, which are, really the cornerstone of cardiovascular health. And encourage, please follow up with the primary care provider. If you have any chest pain, if you have any shortness of breath or dyspnea, edema, any fluttering of the heart, especially with females may feel that, intergestion is, they feel like, oh, it's intergestion, but a lot of times it could be cardiac related. So that's why your assessment, it becomes client or patient specific. But these are the things that you really want to encourage and talk with your clients definitely about following up with their primary care doctor or cardiologist. Okay. So that's a brief overview of the cardiovascular assessment, what you're going to ask for, what subjective data, what you're going to be looking for with your objective data collection. And with all of these assessments, as you practice, you are going to become well-rounded with your healthcare assessment, making you a better healthcare professional. So keep that heartbeat strong and never stop learning. Best of luck on your nursing journey. Until next time.